We are going to discuss very important topic of renal physiology, and the topic is actually renowned by two important names. One is the countercurrent mechanism and other is actually the physiology of the osmolarity in dependence with the ADH. So first of all we will see what is showing in the figure. So as you can see that there are different parts that is showing in the figure. This is actually the nephron, and the background is actually shown by the interstitium. So most of the people are actually very confused about where the different part of nephrons are situated in the kidney. So I draw here, this is actually the kidney. So as you can see that the outer part is known as the cortex, I mention it with C, and the inner part is medulla. So here as you can see that this part is the cortex and this is the medulla. So if we divide it here, like the upper portion with cortex and the lower portion with the medulla, so after that we can see these are the part of renal tubules or the part of the nephron, and the background this is the interstitium. So now we will see how actually physiology works. The physiology works here as you can see that. Now first of all we'll see what is countercurrent mechanism. So countercurrent mechanism is actually a physiology that deal with the concentration of the urine. So how actually the urine is concentrated? Actually urine is concentrated by a hormone known as ADH, that is antidiuretic hormone. So antidiuretic hormone has major physiological impacts on the nephron of the body. And what are the main impacts? Actually it increases the V2 receptors. It also increases the V1 receptor, but main effect on the concentration of the urine is done by the V2 receptor. So when the V2 receptor increases, what actually happens? So before going into the detail, I want to tell you two important things. One is interstitial osmolality. So what is that? So if we see from the old diagram that outer cortex, inner medulla, actually the interstitial osmolality is increasing from cortex to medulla. So as you can see that this is here 300 and it is increasing up to 1200. So as you can see this is increasing. That helps in the absorption of the water from the nephron and ultimately leads to increased concentrated urine. So I will show you two important things more. First of all, these V2 receptor that are actually mainly acting on this part. So what they do, they actually created a space for urea to move out. When urea move out from the collecting duct, they actually increases the concentration of the interstitium and ultimately leading to increased osmolarity. So as you can infer from that, this is actually the major cause increasing the osmolarity of the interstitium. So one important concept that you also need to know is that water moves from low osmolality toward the higher osmolality. So in that case here you can see that if there is 1200 osmolality and here in the nephron is 1000, so water will move out. That ultimately lead to the concentration of the urine. Another concept that I want to tell you, and that is, as you know all, that this is, I'm going to draw, if this is the kidney and there is the renal artery, that renal artery divides and redivides form interlobar and ultimately into the interlobular artery, and that interlobular artery ultimately forms the afferent and the efferent arteriole. So from the afferent and efferent arteriole, all of the urea is filtered and entered here. So when the urea entered here it is almost 100%. But we should know that the proximal convoluted tubule, this part, is actually permeable to urea. So that causes its reabsorption here. When it is reabsorbed here, that actually causes increase the osmolality from 300 to 500. So if here in proximal convoluted tubule, if it is 100%, after reabsorption it comes here, it remains only 50%. When it remains 50%, how can we think that here again it is going to 1200 osmolality? What is the reason? Actually, the main reason is the V2 receptor. These V2 receptor actually increasing the permeability of urea, that not only absorb in the interstitium but also get absorbed in the loop of Henle, this part. So that from 50% here it again comes to 75%. But one important concept, when here in the collecting duct, let me erase all of that, otherwise it will not be easy to understand the things properly. When I erase all that, you can easily see that. So here, if some of it is reabsorbed into interstitium and some goes to loop of Henle here, then the remaining will not be 100%. The remaining will go to somehow between 20 to 50%. So it will also decrease the excretion of urea. So these are some of the most important concepts in the concentration of the urine. Thank you very much. We will see you next time with another difficult topic. I will help you to revise all the topics of USMLE and all the important exams. Thank you very much.